Today I had an appointment for a neurophysiology test called an EMG to test my nerves and my muscles from my base of my neck to the tips of my fingers. The reason my primary care doctor referred me to this particular clinic is because I've been having a lot of trouble for the past few months sleeping specifically, and sometimes it wakes me out of my sleep multiple times a night, and not just one arm, but sometimes it's both arms, and typically I do sleep on my back, so you know, it's not as though I'm laying on my side, which would cause my arm to go numb. Aside from the hour-long transit commute to the hospital and the hour-long transit commute back, everything went fairly smoothly. As soon as I got to the hospital, they did my intake right away, and I didn't even get the opportunity to finish my questionnaire before I got called in by the technician to perform the procedure. This is me speaking here, I don't know the technical terms, but they use this like probe thing on my hands. They tested the nerves in my hands and my arms, and not gonna lie, I didn't love it. I found it to be momentarily, temporarily painful, and afterwards I did have a couple of red marks. Those are all gone now though. And you know, I think as someone who experiences like systemic chronic pain anyways, adding an additional like pain that shocks you wasn't great, but you know, it was very short-lived and immediately the symptoms went away. It wasn't anything that's prolonged or anything like that. So after the technician completed the initial test, the doctor came in and did a few additional tests. So he told me he was doing a pinprick test. So there was a little pin thingy, and he pricked my arm, and he pricked it. So I had some blood droplets all over my arm, all the way down to my thumb. And then he also did where they use the instruments to tap on certain areas in your arm, kind of like the types of tests that we had when we were kids even, to check to see if your reflexes move. The good news and the bad news is that everything came back normal. The good news is he did not discover any entrapped nerves, so that's a positive. He attributes the pain due to having hypermobile joints. This is something that I suspected, but I am glad that my primary care doctor did send me for additional testing just to see if there's anything more going on outside of that. What I can do with that information is continue to do the strength training that I've been doing at home and try to get my joints in a better place so that they can better support my nerves. So I hope this helps. Please let me know if you have any questions. I appreciate you.